In this video, I'm going to show you how to quickly self-assess your hip mobility so you know whether your hips are your weakest links and something you need to be training. Before I get Sheridan in here and show you the movements, I want you to remember that you can film yourself doing these movements or just have a partner nearby so you can get more accurate measurements while doing them. And if you have any pain or major discomfort with any of these movements, know that you failed them already. Don't be a hero and push through them, and know that your hips are a weak link that you should be training. So the first movement we're gonna test is hip flexion, and we're gonna be doing this standing. So flexion is just bringing your knee towards your chest. Sheridan, I'm gonna have you face me this way, and what we're looking for is to hit about 120 degrees. So if you're hitting slightly above 90, know that you're doing pretty well. So let's go ahead and test one side. Perfect. She's right around that 110, which is exactly what we're looking for. And let's go ahead and switch and do the other side. Also, if you have any balance problems, you can do this near a wall. There's nothing wrong with that. But with Sheridan, I'm confident that she's not going to fall over, let's hope, when doing this next side. So when you're ready, go ahead and bring it up. Nice, a little bit more restricted, but it's right around that passing score, so not a huge limiting factor for you. Next, we're gonna face the camera directly, and we're gonna be testing hip abduction, or that's going away from your body. So when you're ready, let's go ahead and kick one side out. Beautiful, and we're looking for 45 degrees, and she definitely passes that on her left side. When you're ready, let's go ahead and do the right side. A little bit more restricted, a little bit more lean there, but it's a passing score. That's where I won't get too anal with a lot of these. If you hit the measurements, it's good, but if you notice a big difference from side to side, know that you can also train that side to try to bring things into a nice equilibrium. Since we're still standing, we're gonna be testing a squat next. So for this, Sheridan, I'm gonna have you face that way. If you need to for counterbalance, you can bring your arms out in front of you, and you're gonna get into a comfortable width with your legs. If you're not sure where comfortable is for you, think about your feet just outside your shoulder width. And when you're ready, we're just gonna squat down as low as you feel comfortable, and we're just looking to get to parallel or even a little bit below. So she definitely reaches parallel with a nice neutral spine, I might add. Any pain or discomfort there? Beautiful, that's a passing score. So that's all of our standing tests we're gonna do. Next, we're gonna be testing rotation of the hips, and that's where a lot of you are gonna see those hip mobility restrictions. So we're gonna be doing these tests in a seated position. So you're gonna find a chair. So we're on a folding chair here, and she's at a good spot where her knee's right around 90 degrees. But what we're gonna do, if we're gonna test our left side first, you're gonna bring the knee up slightly, and you're gonna bring this heel slightly behind you. And what we're gonna be testing is that external rotation on this left side. So you're gonna bring your foot inward as far as you can without moving your femur or that thigh bone. And we're looking for about 45 degrees here. 50 technically, but if she passes that other side, that usually means you got a passing score. After testing the one side, we're gonna relax, and then we're just gonna do the same thing on the opposite. So when you're ready, bring your right side inward. Nice, definitely a little bit more mobility it looks like on this side, a little bit of the shakes I can tell, but she gets past that side, definitely past that 45-degree angle, nice passing score. Now, where most people are restricted is in that internal rotation movement. So let's go back to the left side here. You're just gonna bring knee up slightly. Again, just rotisserie around the femur or that thigh bone. And she's right around that 45, maybe slightly below. So this might be something that we wanna start training. When you're ready, let's go over to the right side. Bring that one out. A little bit further on this side, it looks like. Still close to 45, so it's not egregious, don't worry. But this is something that we might want to implement within our mobility training. So to recap, if you had any pain or discomfort with any of these movements, or you just failed a lot of them and you have a lot of stiffness, then know your hips are a weakest link that you should be training. And if so, that's where you want to check out my hip mobility programs within the membership.